More than 2 months after giving vaccinated adults the green lights to mask off, the CDC today reversed that decision. They're now recommending vaccinated people wear masks indoors in COVID hotspots. Many had wondered whether the CDC's previous announcement in mid-May had been too premature, including the former Surgeon General under the Trump administration, Jerome Adams. He urged the CDC last week to revise its mask guidance in order to combat the surge in infections driven by the Delta variant. I got a chance to sit down with Dr. Adams earlier today and ask him what he thought of today's, at that time, expected announcement and whether he has any regrets about how he handled the pandemic. Take a listen. Surgeon General Adams, thank you so much for joining me today, sir. I want to start by acknowledging that you, from the very beginning when CDC changed its guidance on lifting the mask mandate a couple of months ago, were very outspoken in saying that this was the wrong decision to make. The CDC is expected to issue new guidance today for vaccinated Americans. How do you feel about what appears to be right now a reverse course?
Well, the CDC and my sources are telling me they're going to tell America that people who are in areas of high or substantial transmission should go back to wearing masks while they're indoors, and that everyone in K through 12 institutions should be masking moving forward. And I think that's the right move in the face of this Delta variant. As I've been very public about, we have to be honest when the information changes and when we need to pivot. And I faced that with my past comments on masking, which were based on the science at the time, but the science changed. The science is changing with a Delta variant that is 1,000 times more contagious than previous variants. And so the CDC guidance, new guidance, I think will reflect that.
Let's pick up on that. You just mentioned that your early guidance on masks, and you said to Yahoo News earlier this month that you regretted that. We understand that science changes and people have to follow the science. But I was struck by the question not asked, which is that the only thing that you regret doing or not doing under a president who was actively working against what the science said?
Well, it's a good question that you ask, and the way I look at it is God calls on you to serve, and you do the best you can with the hand that you've been dealt. I'm a Christian. I read the Bible whenever I can, and I can tell you there are plenty of opportunities in the Bible to learn about people who were put in very challenging situations, who didn't have everything going their way, and who just tried to do the best that they could. We need good public servants, whether you're in red states or blue states. And here's a real key point for your viewers. The majority of African Americans in our country actually don't live in blue states. They live in the South, they live in the Midwest, they live in Chicago, they live in Arkansas and Mississippi. So it is incredibly important that we have people who are able to and willing to serve in these administrations to help protect Black and brown people from things happening that in some cases could be much worse if you didn't have a seat at the table.
Yeah, I get that point, but I just want to know, were you in the room able to say to the president, sir, what you are doing or saying is putting people at risk. They are disproportionately Black people. Stop doing it. Were you in a position to do that? Did you do that?
I wasn't always in the room, and when I was in the room, I spoke up, and I spoke up based on information that I had from growing up poor, growing up a minority, but also from groups that I talked to, such as Dr. Montgomery Rice at Morehouse, who I always was talking to, Dr. Hildreth at Meharry College. I always tried to bring that to the table. That doesn't mean that the president is always going to listen to you, no matter who that president is. But it's still important to be at the table.
But Ms. Adams, I just want to just make sure that I'm hearing this correctly. But did you ever say to him, sir, what you're saying is wrong, and it is putting people at danger, and people are dying because you are saying and doing the things that you're doing? Were you able to say that?
I'll give you a real world example of that. I very much spoke up when it came to helping people understand the need for rent protections. and helped people who might not have understand the importance of providing financial benefits for people.
Yes, I get. But with all due respect, Sir General, I hate to cut you off, but you're simply not answering the question. The question I'm asking. Were you ever able to say to the president?
Personal conversations between me and the President of the United States, but again, I will tell you that I have been there. I have fought. And I think it's important that we encourage people to be part of administrations, to be at the table. It doesn't mean that everything that you want is going to happen, but it means if you're not there, then you're often on the menu.
Well, let's say this then. Even if you didn't say it, do you believe that the things that the president was saying and doing were harmful and putting people in danger and, in fact, causing unnecessary deaths? Do you believe it, even if you can't tell me that you told him directly that?
I believe that there are things that happen in every presidency that are good and or bad, and I believe our job is to point out with the opportunities that we have what's good and what's bad. And what's interesting is that when I was there, I was able to have private conversations, which will stay private, and I was able to advocate for the things that I deeply believe in, including health equity. Now that I'm outside the administration, I have a different lever, and you see me talking to people like you see me on social media advocating for the things that I think are important, like changing the new CDC.
I guess that's why I don't understand why you can't say it now. Like you say, you're outside the administration, you're a private citizen, you can say whatever you want. You're a public health official.
What would you like me to say,
you are the chief.
What are you asking me to say?
I would like you to.
Because at the end of the day,
I'm asking you, do you believe? I was asking you, do you believe that the things that the president did and said were wrong, that they created a public health problem, and in fact led to people dying? It's a very simple question, actually.
And I answered your question multiple times, and I'll answer it again. I believe.
I would like to hear the answer because I haven't heard the answer yet.
Okay, so the answer is I believe there were things that the president did and said which were harmful. I believe there were things the president did and said which were helpful, and I was there at the table to try to maximize the good things and to minimize the bad things.
And what were the efforts that you undertook that you thought were very successful in minimizing the bad things?
Well, I think we had 3 different vaccines. This time last year, there was not a single scientist who believed we would have a single vaccine right now. Now we have 3 vaccines. That was incredibly important. And I worked with Dr. Fauci, I worked with Dr. Collins to make sure we had diverse enrollment in those vaccine trials so that we knew they would be safe in African Americans and Black and brown people. That was incredibly important to make sure you had the trust that we do have in the vaccines, even though we still suffer. Again, I talked about the rent protections and the financial support.
I believe that the Trump administration deserved tremendous credit. I believe the Trump administration deserved tremendous credit, actually, for the fast tracking of those vaccines and partnering with private companies. Absolutely. I guess what the question I'm asking is on the messaging front, having press conferences at the White House, forcing the press to sit next to each other when they know that they should be separated, having that Rose Garden full of people without masks on. That kind of messaging that was coming out of the White House, in addition to the things he said, the things he made people do, I guess I was trying to figure out, what did you do to try to mitigate that messaging?
Well, here's what I'll tell you. I'm writing a book, and you can read the book, and you can find out about what happened in the past. I think what's important now is that we reflect on what's going on right now. 300% increase in cases. CDC having to shift their guidance less than a few months after they put it out. Black and brown people at risk, testing worse than it was in December. I think that's what's going on now and that we need to reflect on. But please read my book when it comes out, and I'll give you the scoop in terms of what I experienced being the only Black man in the room, oftentimes fighting alone and often against not just people who you would expect, but against many people who I was fighting for, who didn't want me to be at the table.
Mm-hmm. Well, I just want to say this. I do appreciate that your individual messaging about the pandemic has been consistent, even though those, like you said, made a miscalculation that a lot of scientists made in the beginning about whether or not you should wear a mask or not. You corrected it when the science told you better, and I think that you have been consistent about it. I am still disturbed about the idea that, the president was not being consistent about it. In fact, put people at danger. There are people who are dead now who should not be dead, and a lot of that rests on his shoulders. And it is still a mystery to me why more people weren't in his face saying, you are hurting the American people. But I want to thank you for your time. Come back anytime. When your book comes out, I'd love to have you come back and talk to you about it. I really appreciate your time, sir.
Well, thank you, and please encourage people to get vaccinated. We still have incredibly low vaccination rates in Black and brown communities, and that's what we should be focusing on right now. We can always look backwards, but in order to move forward, we need to make sure we're getting vaccinations and mitigation in communities of color and the support that people need to make healthy decisions.
Thank you so much. Again, I want to thank the former Surgeon General for his time earlier today. The Poor People's Campaign takes its voter fight to Texas. More on the mission next on Prime.